Poor road network, that is one of the major concerns of residents in the Ashanti region. The region, which has always been the stronghold of the governing New Patriotic Party, has, according to residents, seen very little development during the party's tenure, triggering dissatisfaction and disaffection from party faithful. You would recall that Majority Leader Osechi Mensah, during his visit to Swami Magazine, was booed and pelted by angry artisans over the poor road network in the area. While the Ashanti Regional Minister, Simon Mensah, has been dismissing the assertion that the party has neglected the region.
2017, the region has seen 336 separate road contracts with a total length of 6,498.75 kilometers. Out of this, 1,515.06 kilometers have been completed, representing about 23.3%. And the breakdown, we have the first table there for Department of Urban Roads. Department of Urban Roads has awarded 64 contracts. When it comes to the Ghana Highways Authority, they've also awarded 69 contracts. And then Feeder Roads has the largest, which is about 203 contracts, all summing up to the figure of 336. One area people have been yearning for is the construction of interchanges in the Ashanti region. Just on the 28th of July last month, Parliament approved a loan facility of 140 million euros for the construction of the Swami interchange. Besides that, let me explain some things or give additional information. The Sofo Line interchange, which was started by former President Kufuor's regime, also had other interchanges included. One is the Bekwai Roundabout interchange. The other will be the G Roundabout overpass, which we also call interchange. So if the Sofo Line interchange project is finally completed, then it means we have an interchange at Bekwai Roundabout and also an interchange at Konfano Teaching Hospital Roundabout.
Well, on health, the Minister, Simon Mensah, says there has been a 93% increase in the number of medical doctors in the Ashanti region since the NPP assumed office. According to him, in 2016, the region could boast of only 113 doctors, but the number has grown to 218 in 2022.
In 2016, doctors in Ashanti region were 113. As we speak, we have 218, an increase of 105, representing about 93% increase. Let me pick another one, nurses. Of late, I think the issue of nurses have come to the floor, so let me pick them as one of the examples. In 2016, we have 5,936 nurses in the Ashanti region. As we speak, we have 9,645, an increase of 3,709, representing about 62% increase. Let's move on to midwives. We had 1,131, now we have 3,114, difference of 1,983, representing 175%. When we come to the indicators, you realize that when we were the worst region in terms of health facilities, now the situation has significantly changed. And most of the indicators that we had fallen short of the target, now most of them we are within comfort levels within the target. And I'll give you first one, doctor to population ratio. 2016, it was 1:13,798. That meant that at that time, one doctor was to see 13,798 patients. As we speak, we've come down to 1:5,529, but the target is 1:7,500. So if you look at this, it means we are comfortably within the target.
Now, when it comes to education, the minister said senior high school enrollment has increased in the region by 63% from the year 2016 to 2022, owing to the implementation of the free SHS program.
7,159 educational facilities within the region, excluding private schools. What I'm talking about are only public schools. Now, free SHS, here I'm looking at the trend. We are doing comparative analysis of enrollment from 2016 up to 2021. The total enrollment in 2016, both girls and boys, was 67,120. It moved, after the introduction of the free SHS, increased by 23.6%, almost 24%, moved from 67 to 82,984. In 2021-2022, we had 109,857. You can see the significant jump from 67,000 to 109,000 plus. That is over about 64% increase. So it means that Ashanti Region, looking at the numbers, 140 schools, which means that we are one of the major beneficiaries of the President's free SHS policy.
Well, the Regional Minister, Samuel Osemensa, has been speaking to us about these developments and more in the following interview, but also dismissing the NDC's claim of increased membership in the region affecting the fortunes of the NPP.
To me, it hardens me, and it also put a lot of responsibility on me to sit and reflect on the development of the region so far. With press conference like what happened at Kwabri East, I'm not worried about it.
Why are you not worried?
It's a constitutional right, and the person used peaceful and constitutional means to express their worries and their concerns. That one I'm not worried. I'm worried where people try to take the law into their own hands and then maybe express their feelings. That one I don't support it. I don't subscribe to that one. To fully bridge the gap between the expectation of the people that and the actual also some. So definitely once you've not been able to break that expectation gap, definitely people will complain. But I'll be the last person also to say that the Ashanti region has been sidelined in terms of development.
But you just said that the expectation and infrastructure is very key in development and especially in the region.
I'm saying
if you're saying that you have not bridged the gap.
Let's say the expectation gap is 100%.
Okay.
And we work up to bear 60 or 50. You not fully bridge it.
Yes.
That doesn't mean if not performed.
But would you say that the concerns of neglect of the region is legitimate?
It's not.
Why is that?
Not fully, yes. One, let me give you spoke about roads.
Yes.
Since 2017, 336 road contracts have been awarded in Ashanti region alone. And with the length is 6,498 kilometers.
Okay.
So far, 1,515.75 of the 6,000 has been bitumen surface or asphalted, representing just about 23.3%. I want a single government since January 7, 1993 to date that has even performed that 23%. That's 1,515 kilometers of road for within 8 years. I want one regime since January 1993. But you see, had it not been the economic crisis, you mentioned and people say everything is the economic crisis. Why is that governments all over the world are mentioning COVID and then recently or this year the Russian-Ukraine
Ukraine
war.
war.
Every government, somebody should give me one government that has not cited that as a challenge.
But you see governments also moving away from the effect, from the ravages of the war. I mean, of COVID, for instance, and they're growing out of it. Why is Ghana
structures of governments vary. Structures of economies do vary, and depending on the structure of the economy, you may come out early or not. You see, if the war had been between maybe a certain country and another country, maybe the effect wouldn't have been serious.
So that is an indictment on management of the economy and the structures, wouldn't you say?
In all government, and that is what this government had wanted to address. You see, we talk about importation of rice, importation of maize, etc., tomatoes. That's why the government brought planting for food and jobs. And the government knows that if we should have abundant produce, we need a place to keep them. And that is why the introduction of one district, one warehouse. And even when you have the warehouse to keep, you cannot keep them forever, because as long as you have bumper harvest continuously for 10 years, all the silos will be full, all the warehouses will be full. So whilst you can export them, you have to also think about how to change them from raw material, ordinary raw products, to some processed goods.
So clearly, Honorable, you had a plan.
Yes, that's why one district, one factory came in. You see, these policies were not brought out in isolation.
But you have not delivered. That's the bottom line.
We were delivering until the onset of COVID. I want anybody who will be sincere to himself. I will not say that we have not delivered. We were delivering until the onset of COVID.
Okay. Let's return to the issue of the roads. I mean, that is at the heart of the concern.
So I've told you 336, 64 contracts under Department of Urban Roads, 69 contracts under Ghana Highways Authority, and 203 under feeder roads. Do you understand it?
Yeah.
You know, before the COVID, things were moving on all right.
Okay.
And if it had continued that way, and we had even completed even 50%, we will be talking about 3,000 plus kilometers of road. If we have gone to about 75, we'll be talking about somewhere around 5,000 plus kilometers of road. But because of the crisis, you know, the president, if he were to be a prophet, he would have been a perfect prophet. What the president told us during the peak of the COVID, maybe we look at it from the narrow point of view. We didn't do in-depth analysis to get the meaning of what the president was saying. When he said that if people lose their lives, we cannot bring them back to life. But when the economy fails, we can rebuild and bring back the economy. Do you understand it? All that he was saying that once there are some unbudgeted for expenditure we need to make, while there will be some revenue lapses, there will be decrease in revenue, but expenditure will go up. Definitely, simple economics will tell you that we are going to have economic difficulties. It will mean that the budget deficit is going to widen. And once this happens, it will affect several areas. So all that the president was telling the country is that with this pandemic, going forward, we will save lives, but there will be economic downturn in future. But we will know how to bring the economy back. So this is the time we have to work to bring the economy back.
And so for the thousands who are watching you right now in the Ashanti region, many of whom have been agitating for weeks now, how long should they wait to see the roads finished, tarred, and
I cannot give them time. Do you know why?
Why?
It depends on the performance of the economy and ability of the government to pay the contractors who have left site. And I cannot sit here and give timelines because I don't hold the purse. And I don't know when whatever the government is doing, when we are going to get the money. So I don't want to give timelines. But all that I'm praying for, that all the measures and system put in place, all the area the government is trying to source for funding must be realized, even not in its entirety.
But the point of the people is that, granted that COVID has had its adverse effect on the economy, what did the government do for the region in its first term? I mean, this is your World Bank. In the last election, you performed 71%, the presidential election. The NDC obviously appreciated in terms of their figures. Today, we are hearing from the chairman of the NDC that they are carrying out some registration in the region, and they've seen 100% increase in terms of membership. They think that a lot more people are joining their party, and you should be worried about that.
You see, what NDC says in the region is what they are saying. I don't have access to their figures. I don't have access to their records. They have the access. They have said their questions. They have their marking scheme. They can mark it.
But you're not worried. You're not worried that the developments of today will affect your fortunes in 2024.
What I'm worried is when we get is how to get money to give the contractors to go back to site. Not NDC now. No.
But you've had the threats from the people themselves who have said that they are not going to give you their vote anymore because they feel you're taking them for granted.
We are not taking them for granted. So you allow me to explain,
okay,
so that the people will get better appreciation of what I'm telling them. What they did at Swami, I don't support them a bit, not a day, never.
You're talking of the pelting of the MP.
Because we knew the road was bad. We worked for the road to be given on contract.
Okay.
The contractor was working. There was shortage of bitumen in the country. This contractor, I commend him. I drove my heart to him. Had it been any other contractor, he wouldn't have even wasted his time to go and look for bitumen from other country because the government is already owing him. But he went to look for the bitumen. These people who organized the demonstration before the pelting of the chassis water, you went to the regional urban route engineer, and he told you that the contract has now got bitumen surface. Between Monday and Friday, he is coming to site. What do you have to do? You have to wait.
So the action they took was not justified?
Not. Why did they go to the regional urban route engineer if they don't believe him? So you go to the person, and then the next day you come and do demonstration. So why did they go to him then? To do what? 2, after the demonstration, we're not worried. We said if we went through the legal process, it's their constitutional right, they can do demonstration. The majority leader came to explain almost the same thing as the urban route director said. I also went on air, explained almost the same thing as the two of them had said, and we said they should wait between Friday and Monday, the contractor will be on site. As the member of parliament for the area, who has responsibility for their welfare, we've given promises and assurances. He was going there to check whether actually the contractor is on site. And when the contractor was on site, so he was moving with the regional urban rules director and a representative of the company. So where is the need for pelting of this thing? You want the people to be there, the people are there. So you pelt the majority leader water, chassis water, for what reason? I don't support.
So what's the update of that project? Is this progressing steadily?
It's going on.
And we are to finish on schedule?
No, we cannot say he will finish on schedule because there was a time lag where he didn't work, where he was looking for the bitumen.
Okay.
And so definitely I cannot say that it will be on schedule. But what is important is that the contractor is on site and is working.
Okay.
But if we don't care, why did we give it on contract? And we gave it as an emergency contract, not a normal contract. So why did we do that?
So for some of the areas where you say contracts have been awarded, but the contractors have not mobilized to site, what is the...
Not that they've not mobilized to site. They were on site.
Okay.
We can have few, which will not be even up to maybe 2% of the total contract that have been awarded. They were on site, but due to non-payment of interim payment certificate, that's why they've left site. I use my own area, Bosomtwi, as an example. I'm from Bosomtwi. Education minister from Bosomtwi. Regional chairman from Bosomtwi. Do you think we'll be happy to have a contractor leaving site? Do you think? But when we know genuinely, and the president has said several times, that we owe the contractors That is why most of them have left site. We are organizing to get some funds so that we can make some payment. You agree with me that during the first term, there are a lot of money that were paid. At a point, even those the government was owing less than or up to 2 million, were all paid.
Okay.
You do understand it? So if we want power, why shouldn't we pay them if the money is there?
So people must be patient.
Even today, during my presentation at Ministry of Information, I even expressed the appreciation of the region and the government to them, that they've had the patience, and we plead with them that things are not normal now. We beg them to exercise some more patience, and that when the contractors are paid, they will come back to site. If you talk about Kwabri East, any forum that have been, you can call the road minister. I don't want to mention that. Call majority leader and all those people at any forum. I've agitated for Kwabri East. And it's not that the roads have not been awarded on contract. Some of them have been awarded on contract, but the same issue I'm talking about, developed sites.
Right.
There's one contract I have asked that one we must terminate.
Okay. Why?
That is Mampontin Town Road.
Why should they be terminated?
No, it was the groundbreaking was made in 2008 by the president. The contractor could not even finish with the drains. From 2018, we cannot continue like that. Let's get him off.
And you're sure that's not an issue of raising certificate and not being honored?
As you've seen, the work that has been done so far, I'm not a technical person, but I would doubt any certificates have been raised. And if a certificate has been raised, we can pay the person off.
Right.
And give it to somebody who has the capacity. To me, as I've told you, I'm a layman. When it comes to road construction, from my layman point of view, the person hasn't got the capacity. When you go to site and you see contractor that has capacity, you see the equipment that the contractor is using. But when you go and you see one day one machinery, sometimes 2, maximum 3, you can't convince me that such a contractor has the capacity.
So it doesn't give you the confidence that he can do the job. But let's talk about healthcare infrastructure whilst you're there. I mean, since 2018, January, I think, when the Rebecca Foundation, together with the Multimedia Group and your good office, collaborated to build the MBU, I don't quite remember seeing any major facility being commissioned since then. Why is that?
Anyway, not being commissioned.
Yes.
It's surprising, maybe forgotten. But the president commissioned the Kwai Hospital.
Okay.
In December 2020, before the elections. I think October or November 2020.
Is it operational?
It's operational.
Okay.
It's operational. And that hospital was started during the time of the late President Kuchwe Champo. And governments have come, they all continue, they've done their part. The president came, he said, no, this one, we should finish it this time during my first term. We can't wait any longer. He continued with what his predecessors had done, and it was commissioned as functional.
Okay.
Tepa Hospital was also commissioned in 2020. It's part of the Irujet project, and it's also functional. Now, Konongo Hospital is completed, awaiting commissioning.
Okay. So how about the Afari Military Hospital?
Afari Military Hospital, yes, that is about 97%. They are relaying some pipelines, some cables underground. We have almost all the equipment in place, installed. And then the challenge they had at a point was the power supply from the main transformer there. They said it wasn't adequate, and truly a 500 bed capacity hospital, definitely you cannot use transformer. They requested for ECG substation, which we've constructed one for them. Okay. So that problem is also resolved. What they are working on, apart from the cables, are the residential accommodation for the doctors and the nurses. Most of them have been roofed. Okay. Most of them have been plastered. Others have been plastered. Some of them, the last time I went there, they were laying the tiles and all those things. So these are the few things left.
How about Agenda 111? I think you have about 13 in your region.
It's 14. Unfortunately, there's one. I don't know why we omitted it. It's under KMA.
Okay.
And that one, they started, but there's problem with the site.
Where are we with the construction?
Oh, the highest now is about 40%. Some of them 30, some of them 15. Only one has not started. Or let's say, let me add the Bushen one under KMA, because they started and they have challenges with the land. So they are looking for a new site. So I can say that one too is the same.
With 40% so far being the highest, would you say that they are on schedule, and by the end of the president's term, we're going to see these hospitals up?
I cannot promise all of them to be completed. Yeah, I can say some of them will be completed, because definitely they will be at various stages of completion. If you take Asokore Mampong, the land they provided, the consultant said it's not suitable. They've now acquired a new land, where the contractors are supposed to go there and certify whether it's good for the purpose.
And we'll have the full interview air on Joy News Extra and other programs here on Joy News, but you can also find it on our social media handles and on YouTube.